The mood cap helps guide intervention for depressive symptoms. True, false, true. According to the RAI training materials, the mood cap focuses specifically on identifying and managing depression, whether it is pre-existing or newly developed. The overall goals of care for the mood cap explicitly include diagnosing and treating underlying causes that contribute to mood issues, and it guides care professionals to implement appropriate treatment strategies such as medication, therapy, and support. Where are CAPs typically reviewed in the workflow of completing an inter-RAILTCF assessment? A. During the resident interview. B. Before the assessment is submitted to CIHIC. After completing and coding the full LTCF assessment. D. During quality indicator reporting. The correct answer is C. After completing and coding the full LTCF assessment. According to the workflow for working the CAP, the very first step is to complete the full LTCF assessment form and ensure that all sections are coded accurately using observations, interviews, and records. It is only after this assessment data is fully entered that the collaborative action plans, CAPs, are automatically triggered by the software system based on specific patterns in the coded items. Once triggered, care professionals then review the CAP summary to interpret the results and integrate them into the resident's tailored care plan. Which CAP is most likely to be triggered by symptoms of delirium and sudden cognitive changes? A. Cognitive loss cap. B. Mood cap. C. Delirium cap. D. Communication cap. The correct answer is C. Delirium cap. According to the inter-RAILTCF training materials, the delirium cap is specifically designed to identify individuals experiencing a sudden, acute cognitive decline. This cap is triggered when assessment data indicates an acute or fluctuating cognitive change, which can present rapidly as symptoms like disorganized speech, being easily distracted, or an acute change in mental status. What should be done after a cap is triggered? A. Automatically apply all suggestions. B. Refer immediately to outside providers. C. Review the CAP guidelines and consider interventions. D. Escalate to management team as soon as possible. The correct answer is C. Review the CAP guidelines and consider interventions. According to the Working the CAP workflow, once a collaborative action plan, CAP, is triggered, care professionals are instructed to interpret the summary and use the CAP guidelines. Each CAP guideline provides suggested clinical reasoning steps and intervention options for the care team to consider. The guidelines emphasize that CAPs are designed to identify areas for further assessment and collaborative care planning, but they explicitly do not prescribe mandatory interventions or priorities. Because not all triggered CAPs require immediate intervention, care providers must review the options and use their clinical judgment to prioritize them based on the resident's specific needs. A triggered CAP always means immediate action is required. True, false, false. According to the inter-RAILTCF training materials, a triggered collaborative action plan, CAP, does not automatically mean immediate action is required. The guidelines explicitly state that not all CAPs require immediate intervention, and care professionals must use their clinical judgment to prioritize them. Triggered CAPs serve to identify areas for further assessment and collaborative care planning, but they do not prescribe mandatory interventions or priorities. What is the main goal of the FALS CAP? A. To monitor dietary intake. B. To reduce antipsychotic use. C. To prevent injuries and improve safety. D. To reduce communication deficits. The correct answer is C. To prevent injuries and improve safety. The FALS CAP is designed to address the fact that falls are a leading cause of injury, morbidity, and mortality in aging populations. Specifically, the materials note that 10% of falls lead to serious injuries such as hip fractures. The overall goals of care for this CAP focus heavily on safety and injury prevention by explicitly directing care professionals to identify and modify risk factors for falls and to promote safe physical activity while maintaining mobility. It also guides the care team to recognize the links between falls and other contributing factors, like incontinence or medication side effects, and to avoid using physical restraints, as they do not reduce fall risk and can actually worsen mobility and safety. Quality indicators are designed to evaluate both improvement and deterioration in care. True, false, true. Quality indicators are designed to take a broad view of a resident's status by tracking both positive changes, improvements, and negative changes, declines or deterioration, over time. The Inter-RAI LTCF system evaluates these changes using specific incidence indicators, which are categorized into both improvement and decline indicators to help track the effectiveness of care interventions. The Inter-RAI LTCF assessment form is used to trigger QLS through specific data fields. True, false, true. Quality indicators, QIs, are directly calculated and triggered using specific data fields from the Inter-RAI LTCF assessment form. Each QI utilizes assessment level logic to evaluate the assessment responses and determine whether a resident qualifies for inclusion in the numerator or denominator of that indicator. Furthermore, temporary variables used to support multiple indicators are derived directly from specific data fields within sections such as G1, E3, D, and H of the Inter-RAI LTCF form. How is the numerator defined in QI calculations? A. Residents with newly triggered care plans. B. Residents who meet trigger logic. C. Total number of residents. D. Facility average performance. The correct answer is B. Residents who meet trigger logic. In quality indicator, QI, calculations, the numerator is defined as every person who triggered that specific QI. Each QI utilizes assessment level logic to determine which target assessments qualify for inclusion in the calculation. While the denominator includes everyone who was assessed and could potentially trigger the QI, those not excluded, the numerator represents the specific outcome being measured and is defined by the specific assessment responses that meet the criteria for that indicator. Which section of the LTCF form provides data for ADL indicators? A. Section H. B. Section G. C. Section G1. D. Section E. The correct answer is C. Section G1. According to the Inter-RAI LTCF training materials, temporary variables used to support and calculate multiple quality indicators, QIs, including the ADL indicators, are derived directly from specific data fields within sections G1, E3, D, and H of the assessment form. Specifically, Section G1 focuses on activities of daily living, ADL, self-performance, and provides the core data elements for ADL calculations, such as the resident's performance in personal hygiene, dressing, walking, locomotion, transfer toilet, toilet use, bed mobility, and eating.